You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have Georgia's go-to implant dentist, Dr. Alan Arrington. Dr. Arrington, welcome to the program.
Hey, thanks for having me.
Now, for people that don't know your practice, who's the typical dental implant patient that comes in?
Well, we don't really have a typical patient, but we do have a lot of patients that come in that fit into two categories. Some of these people have just a long history of just dental work after procedure, and it's failed. It's just, they've had a long road and they're frustrated with where they are. And they just run out of options and they don't think they have any. So they end up coming to us to talk with us about what their options are. They hear about us from a friend.
And you told me a lot of them, they go to you because they don't want a denture,
True.
a traditional denture.
Yeah.
Is that right? And that's where they're headed?
Absolutely. They think that's their next step. So is it call me or is it call a denture clinic?
Okay.
You know, what do they do? So yeah, so they hear it from a friend. They hear it, maybe they see something online, and it all just kind of starts with a conversation with us over the phone. And we get them in and talk with them about their options. So it's kind of like we give them some hope just having the conversation, but they're comfortable when they come in.
Okay.
They just it's not like they're going to the doctor. They just come in and they feel relaxed. They feel comfortable with us, and then we really get to figure out like what do they want? Like what are they looking to get out of this? And so they come in and we end up talking about implants. We give them a new set of teeth, upper and lower, and where they really didn't know what they needed, they have a solution, and they're happy with it.
Great. What's the second group?
Second group of people, there's probably some watching us right now, and they have dentures. They already have them.
Okay.
They've had them for years, and they've been unhappy, dissatisfied, unable to eat salads, unable to, the adhesive, so many things that they don't like, about those dentures. They're the people that come in. They've been told that they don't have the bone structure. They've just been dealing with this thing forever. Okay. And they come in because they want another option. And we talk to them about the options. The same people that have been told they have no options, with our technology and everything that we have in the office, we're able to place implants and give these people a whole new ability to smile and talk and be comfortable.
Now, you told me this on the phone. I mean, a denture wearer can literally, and correct me if I'm wrong, can walk in the day of the procedure with no upper and lower teeth and walk out with upper and lower teeth that don't come out. Is that true?
If they call me today,
yeah,
they can come in next week to have a conversation with us. 3 weeks from that appointment, they can leave with teeth that do not come out.
Very nice.
It's that simple.
So I think you said that you can do it like within as little as 2 or 3 appointments.
Yeah.
You meet them, take measurements, then the next procedure they get their teeth.
Yeah. So it's because of the.
Is that rare though, or is that common in your practice?
It happens every week.
Okay.
Yeah.
Okay.
I mean, yeah, we do this every day. So the technology that we have, dentistry's come a long way. There's just things out there that we have available to us now that just takes so much away from the procedures that they've been told they need in the past. We can do it so much quicker, so much more efficiently. They don't have to go to 3 different places to get it done. We take care of everything in our office, and they're smiling.
I think you said that you're literally printing teeth, making the teeth in the next room.
Yes.
Is that right?
Yes.
So you just print like a digital printer that prints the teeth?
Yes. So we have, everybody hears about 3D printers, the technology, scanners, intraoral scanners, facial scanners. So the technology is just unbelievable. I use it every day. I'm still amazed by it, but it's revolutionary. We have all of it.
Nice.
And we are able to provide teeth the same day that we make. We're not sending it off to, wherever. We are making your teeth.
Is that why you're able to do it so quickly?
100%, yes.
Now, correct me if I'm wrong on this one too. How dental implants are typically done is you go to one doctor that does the surgery, another doctor that puts the teeth on top and then maintained elsewhere. You do all three parts.
Yes. Yes. We're able to see them for the initial consultation.
Okay.
From there, if they're ready to move forward, it depends on how motivated they are. But a lot of these people are so frustrated that they're really motivated. So from the consultation, sometimes we have to set up one more appointment for the scans and the 3D x-rays, the CTs. Their next appointment is surgery, and they are leaving that day with a new set of teeth.
So how soon could they eat after it's done?
Sure. So when they go home from the appointment, day of surgery, new teeth, they can eat soft foods that same day. After everything heals, a short time later, they're back to their regular diet.
Like what? I mean, can you eat like with your front teeth, like bite a carrot or an apple, or you have to be careful with the front teeth?
No, 100%. Anything that you could do with your real teeth when you were younger, you can do with these teeth.
Okay. And what do they like more? What they can eat or how good it looks?
Both. They really like the function, the ability to just chew and eat whatever they want. But the appearance makes a big difference too. They may not come in talking about wanting a new smile, but when they actually get it, they can't stop talking about it. So
what are the age ranges? Like how old can you be on the upper age range to get this done?
So we have patients in their 30s all the way up to, I think our oldest patient was 96.
Why would a 90-plus-year-old want to do this?
I hear the age part every day.
Okay.
And it's just something that they decide is important to them. They cannot eat. They're just not, their quality of life is affected by this. And their age is not, it's not
so
something.
So 90, what'd you say, 96?
96.
They're not more likely, the implants, to fall out at 96?
If they're healthy patients, there are risk factors, but no, the age has, if they have bone and they're unhappy with their ability to chew, they're not happy with their ability to eat, age has no bearing.
So 96-year-old did this. So when you hear like a 75-year-old saying, I'm too old to do this, does that ever happen?
Yeah, I have 60.
So that's not too old at all?
No, never.
No, what about medications? I mean, statistically, if you're over 70, you're on 4 medications. Can you do this and be on some medications?
Absolutely.
I mean, do your patients?
Yeah, we do a thorough health history review with you. Let's say you're a diabetic. You're on meds for that. So we review that, and as long as you're controlled, and you may be on other meds, blood pressure meds.
Is that right? Okay.
Yeah, all of these things are present.
And you'll talk to their medical doctor if you have to.
If we need to do consults if they're on blood thinners, we will do consults with their medical doctor. But during the sedation, they're sedated for this. We manage them very well. This is a very low risk procedure.
Okay.
Their meds are reviewed. It's not part of the equation.
Now, at the top of the show, I said that you were Georgia's go-to implant dentist, but you serve a lot of areas. Is that correct? Like even neighboring states, people come to see you.
People come. We draw from East Alabama, all over Georgia. We're about an hour and a half south of Atlanta. We have people drive down from Atlanta.
Is that right? Okay.
We have people drive from Macon, South Georgia. The draw to this is people are frustrated and they just look for solutions. So, I'll drive an hour for a good restaurant.
Okay.
So why would somebody not drive?
So people are driving distances to see you.
Yeah, 100%. Yeah,
but also because you do it quickly. Look, I've had dentists on the show, and people need to know I'm not trying to side with you, but it takes, I guess, up to 2 years for some people because they don't have their own, I guess, labs. They're not making the teeth there.
Well, there's several factors that go into how long it takes us to get you teeth, but we've simplified it with our technology, with our training, that allow us to provide the service very fast and in some cases less expensive, not as big an investment for somebody that's been told that it's way more. Now,
after dental school, I think we talked. You travel all over the United States learning implant dentistry. Mm-hmm. Is that right?
Yes, sir. I've been to Kentucky, the Medical College of Georgia, implant training. Continuing education is something that you never stop learning. So we go wherever we have to. We've been to California to take courses. We've been all over to continue to invest in our practice so that we can help our community. Because this service, I mean, it's fun to do, but it's just very satisfying to be able to help somebody like this.
Okay, good. What's it like when they look at the mirror for the first time?
It is dramatic. It's emotional. Like I said, we have people that they're overcome with emotion. They haven't smiled in years. They've been embarrassed. They've actually covered their mouth for photos. They might not even have a photo of themselves smiling. We ask for that information sometimes.
But what if you have bad gums? I mean, if you have bad gums, can you still do this? Will the implant stick in there?
Most patients that come in have some form of bacterial infection.
Okay.
During this procedure, we clear that up. We clean out the infection. It's not a problem with the implants. The infection is gone through this procedure.
Their breath gets better?
Halitosis, bad breath, the infection, missing teeth, all of that is fixed the day of the appointment that you have this done. Yes.
Now, we had a bit of a discussion on the phone. You say a lot of people hold on to their teeth too long. That most of these people have not liked their smile or teeth for like years and years. Is that right?
100%. Everyone that has failing dental work, gum disease, bacterial infections, they've been told before. They know. They've been putting it off. So it's just a matter of them coming in and letting us go over the options. But it's common. It's not unique, and it's still, you can get this done even if those things are present. So
now Medicare, Medicaid, even the best dental insurance doesn't really cover this, but you say people are financing these procedures. Is that correct?
Sure. Yes, they are. So we go over everything with you. Once we find out.
Yeah, payment plans.
Sure. Yeah. Once we find out what the problem is, we have treatment coordinators, and they're great. They will go over step by step.
Okay.
If you do have insurance coverage, great. It's usually you have $1,000, $2,000 of benefits per year. We're going to use that.
Okay.
Whenever we can. And then we go over the remainder, and we do have several options for you to get this done. So the payment plan, the cost, it's all covered. You will walk out of the consultation actually knowing exactly what you're going to come out of pocket for the entire thing.
Now you say, there's a lot of dental implant advertising on television, the big guys.
Sure.
And you're substantially less than those people.
We are.
Is that true?
Yes, we are. So when we are able to bring them in, do it in one day, provide the services there without sending them to 3 different places, we can offer that at a lower price.
So if a patient fits into one of the 2 categories, either they're currently wearing a denture or it's been determined all of their teeth have to come out, what are their options when it comes to dental implants in your practice?
So there are several options.
Okay.
The first thing is come in to talk with us about what those options are. They can have teeth the same day that don't come out. They can have snap-on dentures made, 2 implants in the front, 2 implants in the back. The teeth snap in.
Okay.
They still take them out. And then I guess 2 implants on the front, 2 in the front on the top. Implants still snap in.
So a snap in, snap out denture.
Still they're snap in dentures on implants. They're gonna move a little bit. They're not fixed. They're not permanent. But it's still, if we got to make a denture, we're talking about the implants because it just
so secures them in there.
So much better.
Okay.
I can't guarantee any level of satisfaction with a regular denture. I just can't. So that's why we're going to talk about the implant options. The roof of your mouth, tasting the food, whatever you're drinking, if your roof of your mouth is covered, you're not,
tasting as well.
It's frustrating.
Okay.
Yeah. So the implants, take that, it's gone, it's not there. So it's a whole nother.
The palate is no longer covered. So what about the option where they get upper and lower teeth that don't come out? How many implants does that take on the lower and upper?
4 to 6. We always, depending on the bone that the patient has, but 4 to 6 implants, teeth go in, they can't take them out. They have to come see me to get them out. So yeah.
Now the maintenance on this we haven't talked about.
Sure.
Do they come in just like regular, like if they had their own teeth, like every 6 months, come in, get them cleaned?
They've got to take care of the implants just like they would their regular teeth. Easy to clean, but yeah, they do come in for regular visits, a couple times a year, every 6 months. We're going to take a look at their implants, and make sure they're doing a good job with their home care, and that's what's going to make them last forever.
So they're numb, and then also what, IV sedation?
They're numb with anesthetic, and they're on an IV and sedated for the appointment. So they don't remember coming.
Is it safe?
It is safe. So they're monitored. We have, their oxygen, their heart monitors on. It's safer. If they have health problems, it's actually safer to be sedated, because if they have, let's say their blood pressure goes up, I can give them meds to control that during the sedation.
Was that right? We talked about this in the green room. You said, I don't want to go negative about anybody, but it's like and again, I'm paraphrasing, but is it a philosophical difference? Like some dentists will look at her and just say, let's remove lower and upper teeth, and you want to save teeth when you can. So listen, because you don't just do one thing.
So when I talk to people, if I'm talking to someone that is interested in this, that's my age, I'm treating them like they were my wife. Okay? If I'm talking to an older person about this, let's just say somebody in their 70s, I'm talking to them like they're my mom.
Okay.
It's every person's different, but I do not want them to have to go through more dental work that they don't have to go through. So that's why it's so important for people to listen.
So if you could save teeth, you're going to do it. Absolutely. And you do it all the time?
We do both, yes. So if what's best for you is implants and fix your teeth, that's what we're going to do. If you need all implants, that's what we're going to recommend.
We checked you out, anticipating you coming here. I mean, you've got great Google reviews. I mean, people just like you. And you're all over the internet too.
Yeah, they're authentic reviews. We don't, there are people that pay for Google reviews. We don't do that. When somebody writes a review for us, that is truly how they felt.
Nice, very nice.
And that's
because nobody likes the dentist, right? Did they still say that to you? Like, hey, no offense, doctor. What do they say where you are?
Yeah, some people say it. Some people don't, but we all know it. So yeah, but they say it. But when they leave, we do get complimented.
Is it a challenge for you? Like when they go, no offense, I don't like the dentist. Do you think, man, I'm going to win them over?
I know that's our goal. So that just goes, like we approach every patient the same way.
Okay.
So yeah, we don't. Yeah, people say it. It doesn't offend me. It doesn't. I don't even think about it. It's just I get it. But like when they leave, we want them to be glad that they found us.
Now we were kidding about this on the phone, but the most expensive thing about this is going out to eat all the time. Do they tend to want to go out to eat more?
They want to do everything more. They want to go out more. They want to talk with family more. They it changes so much. When you wake up in the morning and you don't smile because you don't like your teeth. When you go to bed at night, it's the last thing that you see. So people that go from, not being happy with their smile, with their teeth, that everybody sees every day, and then literally like one day and it's fixed, that's what's the satisfaction for them and for us to be a part of that. It's great.
You told me that people with bad teeth will tell you they feel judged by other people.
Sure.
Is that right?
Yes. Yeah, they will not even apply for the job, for the promotion, because they think
is that right
that they're looked down upon by others because they don't smile. They're never happy. So yeah, it's
that changes. Do you ever hear somebody's hard luck story? And we're short on time, but you're on the consult. They're telling you their hard luck story, and they're going to move forward with this. Do you ever get like excited, going, they have no idea how good this is going to be?
I'll tell them.
Oh, really?
Yeah. If I know that we try to hit home runs for everybody, but if I've got somebody that I know that their personality's there, they're just sheltered because of, their smile. Once I feel like it's that feeling that you get, but like when they're there and I know that I'm about to hit a home run, I'll tell them.
That's nice.
And they, we get that kind of look and then, yeah.
Do you have like partners, husbands and wives that one gets it done and then the other one comes in and gets it done?
Funny you say that. Yes, we have that frequently. Sometimes they come in together and they both do it. Sometimes the first one does it and the second one's a little.
Who goes first?
Apprehensive. Usually the wife.
Okay.
Usually the wife. Husband may be a little apprehensive, but the wife changes everything for her so quickly and so dramatically. Before a few months pass, husband's already in talking about the same thing. Yeah.
Now we got about 1 minute and 30 seconds left, and I know you have more photos.
I got one more. Can
Okay.
I show you
okay.
this one?
Let's do it. I'll rush you a little bit.
Okay. All right. Before and after.
Oh, wow. Big difference.
Younger patient. Totally changed her life because she made a decision to do something about it. History of just bad teeth. Her family lost their teeth early. She thought a denture was her only option because it's what her family had done. But she came in and talked with us. This lady, she works a regular job. Life was affected by her smile, by her lack of a smile.
Just never smiled.
Never covered her mouth.
Is that gum infection? I mean, what's going on there? Just bad gums or something?
She had a lot of different things that led her teeth to be in the shape that they're in.
Okay.
Bacterial infection, gum disease, definitely part of it for her. They're removing her teeth, for her, that was the only option. Okay, she had to go to an implant solution.
Okay.
Dentures, yeah, that was an option for her. I would not have wanted to be part of that just because she would have been frustrated with it.
So she has upper and lower teeth,
She's walking
brand
around.
new, that supported by dental implants.
Absolutely. Yep. Changed her whole, her dress, her appearance, her smile.
So if you're only missing one tooth, help me understand, why would you want to get a dental implant over a traditional bridge?
Well, a lot of people have bridges, so they've heard about them. So that's one of the things that we talk about. We talk them through, but an implant is just a better option. An implant, we do not have to file down the other teeth.
Okay.
Cleaning under a bridge, is another step people don't like. So an implant, if we have to compare, what's the best option and what's the next best option, implant's the best option. It's replacing your tooth as naturally as possible, and we don't have to do anything to the teeth around it.
So what about cost?
So the cost in the long run, it's really about the same. Implants are going to last. It's a great replacement, and you don't have to worry about having to fix it down the road, do a root canal. If you have a bridge and then one of the teeth starts to bother you on the bridge, you have to go get a root canal. So long term, I would say the cost is comparable, just implant.
Okay,
is just
so
a
if
better
it was
option.
a family member of yours and they were of the age that they could do this and they were just missing one tooth, would you never do a bridge on them? You would always do an implant?
Almost never do a bridge. I would almost, yeah. So if it's my wife, my mom, I'm going to tell them implants are what we're doing.
Okay.
And if for whatever reason, health reasons, let's just say they're a diabetic, maybe we would do a bridge.
Okay.
So I'm going to say,
Depends on the person.
yeah, but implant almost always.
Almost all the time.
Yes.
So you're known for sedation dentistry in your practice. So what are the different levels of sedation you offer in your practice?
So 3 levels: the nitrous, oral sedation, and IV sedation.
Okay.
Somebody's nervous, they just want to take the edge off a little bit, nitrous is going to work great for them. Most of our implant patients, we're doing IV sedation.
And by the way, backing up, the nitrous is what, the gas?
Yeah.
Like the laughing gas?
Laughing
they call
gas,
it?
yeah. People are going to, yeah, that's what they're going to hear. Yeah, so that's the nitrous. It works great. It's immediate. There's no recovery. It works for a lot of people.
Okay.
For the implant patients, this is a little more invasive, a little longer procedure. So, taking a Valium ahead of time, taking a pill is just not going to quite get the sedation done. So that's why the IV sedation is so great for the implant patients. They don't remember anything.
Is that right?
Yeah, it enables us to get this procedure done, and it's not a bad experience because they don't remember.
They don't remember.
They don't remember the experience.
But they're a little bit awake though.
They're breathing on their own. They're conscious, but they're sedated. So they will not remember that they had a dental experience because they're sedated.
So what do you monitor under IV sedation?
Sure.
You're looking at what?
We're looking. You can basically everything that they're monitoring when you have surgery at the hospital. We're monitoring your pulse ox. We're monitoring your breathing.
Okay.
We're monitoring your heart rate. Everything that we need to keep you safe. We're monitoring during the entire appointment.
I just want to get a ride home.
They have to have someone bring them to the appointment and take them home. It's a very comfortable setting, and it allows people that would have never even considered coming in to go through the whole procedure and not have a single negative thing to say about it.
A lot of guys don't, a lot of general dentists, I found out, don't do sedation.
A lot don't, but if you get implants on the table and you start placing a lot of implants, people are going to want to be sedated for this.
So the pill's not enough in your opinion? Because I've had some people say, Randy, just giving them a pill's okay.
Yeah.
What's your thought on that?
There's people that do it. I do not. I just prefer to have the patient comfortable and predictably able to go through the procedure, because trust me, nobody wants to wake up in the middle of this thing and just the anxiety come back immediately.
Okay.
And so that's why the IV sedation is, to me, it's just part of the equation. It's something that you need to have done.
We're completely out of time. Final message to the patients.
Sure.
Let's say they're in the two categories. One group still has teeth, but they're so bad, they're coming out. They're going to end up maybe in a denture. They don't want a denture. Or the group that's already in a denture, they're watching this. Let's say they've heard what you have to say, but they're still skeptical or maybe afraid. What do you say to them?
You need to ask more questions and come talk to us.
Okay.
We do a very good job of trying to make people feel comfortable about this procedure. So the first step, you do have options, number one. But come in and talk with us. You're a month away. If this is something that you want to move forward with, you're a month away from having a new smile, new teeth.
Very nice.
Ability to chew. Yeah, the first step, whether you have dentures or whether you've got missing teeth, years of bad appointments, bad experiences, the first step is finding out what your options are.
Okay.
And with us, there are definitely options.
And what do you prefer? They go to the website and make an appointment, or just call your office?
They can do either. They can, whatever's easier for them. If picking up the phone and calling is the easiest part, we'll get them in. If they want to go to our website, they can schedule online, or they can click the forms and we'll call them.
Well, Dr. Arrington, thanks for coming to the show. We're out of time. Good stuff.
Yep.
Appreciate it.
Yep.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.